Hello, Dr. Vimal.
Uh, yeah, good
Good
evening, sir.
evening, sir.
Good evening.
Hello, Professor Nath.
Good evening, sir.
Good evening.
I'm just waiting for Dr. Sital. Dr. Sital, are you there?
Let us wait for a few minutes.
Yeah, I'm just. Dr. Sital Kaji Srishta, have you joined? Welcome, Dr. Sushant Mallavarachi, our treasurer of SAARC Regional Veterinary Association. Welcome, Dr. Ijaz, president of Sri Lanka Veterinary Association. Welcome, Dr. Akash Parotia from Maldives.
Thank you, Dr. Vimal. Have a great evening from my side and belated happy World Veterinarian Day.
Yeah, thank you, sir. I just got a message that in another 5 minutes, our president of World Veterinary Association is also joining with us, along with our past president of World Medical Association, then president of our Indian Medical Association. So just 2 to 3 minutes, we will start.
Yes, sir.
Dr. Bimal?
Yeah. Good evening, sir. So let's start. Good evening, one and all. My name is Dr. Bimal Kumar Chaudhary. I am assigned as the Program Director of SAARC Regional Veterinary Association. SAARC Regional Veterinary Association is the association of 8 national associations of Southeast Asia. It comprises our national associations from India, Nepal, Bangladesh, Pakistan, Afghanistan, Bhutan, Sri Lanka, and Maldives. So first I would like to invite the General Secretary of our SAARC Regional Veterinary Association, Dr. Sital Kaji Srestha, to welcome our delegates. Dr. Sital Kaji Srestha, please.
Thank you, Dr. Bimal. I'm sorry that I'm a bit late as I was in back-to-back meeting here in Nepal because this from today we have a Nepal Investment Summit here in Nepal. So distinguished delegates, ladies and gentlemen, first of all, on the occasion of World Veterinary Day 2024, I would like to pass my greetings to all the veterinarians who is available online. Then, on behalf of the SAARC Regional Veterinary Association, and in the absence of our founder, president, who was also the president of Indian Veterinary Association, late Dr. Jananthan Kadian, I take this moment to observe a condolence for him. It was a great loss to our fraternity, to the SAARC countries. I don't want to, for the delay, I take this opportunity to welcome all the participants, especially the invited delegates. I welcome Dr. Susen Kumar Panda and the newly elected, the President of World Veterinary Association, Dr. John Dijong. This evening we have the fraternity from Medical Association, Dr. Navin Malhotra, the Secretary of SAARC and Anesthesiologist Association. I welcome you. Also, I take this opportunity to welcome the past president of World Medical Association, Dr. Hedi, and the president of Indian Medical Association, Dr. Asokan. Similarly, the Secretary General of Indian Medical Association, Dr. Anil Kumar. I welcome you all. I also take this opportunity to welcome all the recipients of SAARC Regional Veterinary Association, these eminent personalities. This is the second year that we have been awarding the veterans of each and every SAARC countries. I take this opportunity to welcome you and to congratulate on behalf of SAARC Regional Veterinary Association. And I don't want to miss other people like Dr. Rakesh Gaur, who is the editor-in-chief of Journal of ISA. I welcome the president of Association of Veterinary Anesthetists and also the associate editor. I welcome the HOD of Head of Department of Surgery from the Veterinary College in India, Dr. Professor Indramani Nath. Similarly, Dr. Kenneth, Dr. Mohammed, the president of Sri Lankan Veterinary Association. I welcome you all. And I just want to make one remark that this April month has been a great month for us, for we both the fraternity from medical and human medicines, because we have been marking the last Saturday of April at the World Veterinary Day, and similarly April 7th was marked as the World Health Day, which we can regard as a special day under One Health concept, now which is being laid in almost all the countries. With this, I wish for the successful completion of this virtual workshop. Would like to thank SAARC Regional Sri Lanka Veterinary for providing this platform, and I hope the today's topic, advancement in anesthesiology in SAARC regional countries, would be a great eye opener for the veterinarians of this region. So with this, I end my remarks. Thank you, Dr. Bimal. Thank you all the participants for me.
Thank you, sir, for your opening remarks. In fact, we have been working on this One Health since long. Now there is a quadripartite agreement within WHO, WOH, then UNEP and FAO to work together to combat this antimicrobial resistance, zoonosis. And we have been conducting with the workshops with our physicians fraternity, like laparoscopy, ophthalmology, then orthopedics. So now this topic we have chosen as an anesthesiology as a new area where we can work together and we can learn from each other. So without further delay, now I would like to invite Dr. Susen Kumar Pandai. He is the Dean of College of Veterinary Science, and he is also the Education Committee member of World Veterinary Association. Recently, he was there at World Veterinary Association Congress at Cape Town, South Africa, and he has interacted with our fraternity from different countries. And I invite him to setting the scene. Sir.
Thank you, Dr. Bimal. I also thank Dr. Siddhal Kaji Shrestha. Wish a belated Happy World Veterinary Day 2024 to all the esteemed delegates, speakers from almost all the countries of South Asia. A mission for the profession through this association, newly emerging association in this region of the world. So I thank everyone for participating and contributing for the sake of the profession on this very first day after the celebration of World Veterinary Day. It is a privilege on my part to be a part of this great event. Again, a topic on anesthesiology is chosen, which is really a precious topic for all of us. As you all know, the surgeon is a precious part of a veterinary clinicians. If a veterinarian get a name and fame, it is mostly due to the best surgeons. So a successful surgery depends upon a successful anesthesiology. So most important aspect, expertise and skill on this area is a must for each and every veterinarian. It is not limited to a specialized veterinary surgery expert. So there is a demand of a veterinary surgery, specifically anesthesiologist, in the field in almost all the parts of the world. So you have to very well take care of this important area of veterinary clinical practice to have a success in the clinical practice and to get a success in the field of this profession, of this great profession. So World Veterinary Association has rightly established World Veterinary Day to celebrate every year on this last Saturday of April to recognize the invaluable contributions of veterinarians to animal health, welfare, and public health, and a vital role they play in caring for the creatures, whether it is great or small. So a global celebration honoring the veterinary profession and expressing gratitude for their dedication, expertise, compassion towards all creatures. Ultimately, animal health is prioritized. But safeguarding animal health having profound effect and impact on human well-being. So again, we talk of animal health, but now it is having indirect impact on human health, for which we all are concerned and also discussing for One Health. And everybody now taking care of the theme, how to go ahead with the message of this year's theme, essential health workers. Really, veterinarians are essential health workers. Again, emphasize their crucial role in preventing zoonotic diseases. It is a fact. Veterinarians' role have impact on human health. We all know that. They are in many ways responsible for the growth and survival of human civilization. And above all, nothing but One Health and nothing for the whole environment. If we consider now this profession, everyone is looking for, it is not nothing, because each and every country is now looking for GDP, economic growth through livestock sector. Everywhere, farmers' income is not increased, though there is increase in production in almost all the countries. So now this sector is contributing for the farmers' income in many ways. As you all discuss about food and nutritional security, of course, livestock pays highest for the nutritional security. We cannot think of nutritional security without the livestock sector. There is a demand of veterinarians everywhere, even in number, even in their contribution also, even in any discipline, any field. Now it is not that the veterinarians are limited to only the veterinary service. We can think of human health or human medicine. We can think of defense service. We can think of administration and policy. We can think of agriculture, and above all also we can think of environment. The role of veterinarians are enormous everywhere. Of course, opportunities are there, as we have all realized that. But the challenges are many for the veterinarians. Everywhere, developing countries, developed countries, even also poorer countries, people are facing a lot of challenges. Essential health workers are in very difficult situations. We have to deal with animal body weight, more than 300 kg. We have to deal with animal shed with good biosecurity. We have to deal with a laboratory with the best biosafety measures. We have to deal with the medicines and the diagnostics and the vaccines, which should be affordable. As we all know that many times cost of the treatment and prevention is costly than the animal. So it is a challenging situation for all essential animal health workers, the great veterinarians. So with all challenges, we have to think of the opportunities. And above all, again, since we all have realized whether it is anesthesiology or a pathology or orthopedics or medicine, whatever it may be. The concept of super specialization is coming up, and a veterinarian in many countries looking after almost all the disciplines of a veterinary science. So a great challenge. Experts are less, skilled persons are again are also having lack of expertise. They are not trained, and there is a demand of doing all types of works of every discipline, irrespective of any discipline. A veterinarian is asked to do all types of works, just like an all-rounder. So with all these challenges, a veterinarian is trying as essential health worker to meet the demands of the public, to meet the demand of the animal owners, and above all, the animals. So it is a day while veterinary not only celebrates veterinarians' past achievements, but also looks for the future. Contribute to the world where all animals receive the care they deserve. So this is the contribution of the veterinarian. So I hope the veterinarians must fulfill the very purpose of celebrating the World Veterinary Day and keep the prestige of this great profession and satisfy the expectations of its clients, its animals, and above all, the human civilization, the society. Once again, I thank the organizers for celebrating World Veterinary Day in a very scientific way with the deliberations on a very special topic like anesthesia, with very distinguished speakers from all over the world. So I hope the learning will be very much useful for all, and a message of wisdom from this webinar will go to all the veterinarians for its application at each and every place of the world. Thank you all.
Thank you, sir, for your insight views about our veterinary profession. In fact, there is a person named Claude Berglat. During the period of 1712 to 1719, he was a French lawyer, but he was maintaining a large number of good horses, and he was authoritative on horse management. In those days, large number of cattle were dying due to some unknown diseases, causing a heavy loss to the animal owners. So Borglat wanted to control the deadly disease. He took the permission from King Louis XV to start a veterinary college. For that, he learned the basic things like anatomy, physiology, pathology, and pharmacology animals from our physicians and surgeons. And the first veterinary college in the world was started in 4th August 1761 in Lyon, France. He himself started teaching the subjects. So we veterinarians have started learning always from our physicians counterparts, because they are the person who have ventured a lot, and we have included our this allopathy type of treatment in our animals. Though there are some other methods of treating animals through traditional medicines like traditional Chinese medicine, Ayurveda, acupuncture, but mostly the allopathy is taken into consideration since the last 200 years we have been implementing it. So without further delay, I would like to invite the president of our World Veterinary Association, Dr. John De Jong. He was having some problem in joining due to his network. Dr. John De Jong, have you joined? Okay, I think when he will join, we will just invite him. So without further delay, We will move to our next speaker. Yeah, I would like to invite Dr. Ijaz, Muhammad Ijaz. Are you there, Dr. Muhammad Ijaz? Okay. Dr. Rakesh Garg, the editor-in-chief of IJA, Dr. Anil Kumar Nag, all are joining in another few minutes. So I think we will continue our technical session, and meanwhile, when they will join, then we will start our program. So may I invite Dr. Kenneth Joubert, the veterinary anesthetist, South Africa, to present his presentation.
Oh, there we go. Right, I will do that for you right now. I just want to share my screen.
Yeah, you are being, I think you are the co-host right now. You can share your screen.
Yes, yeah, it should start broadcasting everything. What does it want now? There we go. And hopefully now you can see reducing anesthetic mortality on your screen. Is that correct?
It's
okay.
Yes.
Cool. There we go. Right. I'm ready. I just want to thank you very much for the invitation to talk. It's a pleasure to talk, and you give me about half an hour to talk in. So this was a talk I did at the World Congress in Cape Town, so I've reduced it a bit to talk about anesthetic mortality. That's what the main topic is. It's a little bit about what causes it, as well as how do we prevent it, or what can we do to reduce anesthetic mortality. And I always think there's this conflict that's born out in this little cartoon here. Surgeons want to do things and they want to do surgery, but everything we do has risk. There's no benign therapies, if I can put it that way, in the world, or very few of them in actual fact, because everything we do has a risk for harm. And of course, if you have an anesthetic, you have a risk to die or have something go wrong. And people always ask me, how do you avoid an anesthetic mortality? I say, simply just don't do an anesthetic and nothing will die. But life's not that simple, and we have to do things to help patients to reduce suffering, treat diseases, sometimes make diagnoses, etc. And this is a very old study, but the point behind the study is that often what leads to death starts hours beforehand. And if you look through this is a human study, but things often started potentially 6, 7, 8 hours before something went wrong. And so you can see at around 9 o'clock in the morning, everything was normal. By 3 o'clock that afternoon, the patient arrests. But you can see that things have actually changed over time. And picking up these small changes is actually very, very important. So what determines risk? We're going to spend a bit of time talking about it and the factors that affect risk. And some of the things are things we can do something about, and some of them we have no control. If we have a sick patient, we have a sick patient. We can try and make them as better or as healthy as we can before an anesthetic, but it's not always going to be possible. And so a lot of what I'm going to talk about in the next couple of slides comes out of these two studies that were conducted quite a few years ago. One is the confidential inquiry into small animal fatalities, and then, of course, the confidential inquiry into equine fatalities. And one of the things that's always a correlate is time. The longer your procedure, your anesthetic, your surgery, the more likely you are to die. And that's something we have control over, because we can prevent unnecessary prolongation of any procedure we do. And I often find when I go to practices, you start doing a dental and the receptionist will come up to you and say, oh, Mrs. Smith's here. She just wants to get this or wants a piece of advice, and off the vet goes to go and give that piece of advice, and what they're doing actually stops. And so that's one of the areas where we can actually have an impact is on time and reduce that time as much as possible. Very much like they do in the airline industry, that principle of a sterile cockpit. When a plane is taking off or landing or in final approach, nothing interrupts the pilot unless it's catastrophic or absolutely important. And we could do the same thing. Minor things can wait. Once we start anesthetizing a patient to take them through a procedure or a surgery, that becomes the most important thing. So there's very few things that should stop that process. The other thing is to find out how we can do this most efficiently. And working at academic institutions, I can tell you those are places of inefficiency, because you wander from department to department to get everybody involved. Is actually quite challenging. Whereas in small animal practice or in private practice, it's certainly a lot easier for us to control that length. The other thing is to look when patients die. And the first 2 points I wanted to highlight is with pre-medication and on induction, which is largely about our choices of medications and drugs we give, has very little impact on mortality. If you look in dogs, it's 1% or 2% of cats after pre-medication. In total, it's less than 10% that are actually impacted by our choices of drugs. By far, the vast majority die in the maintenance period or post-operatively. And that is an area that we can certainly work on to improve. And so a fair portion of my talk is going to be focusing on how do we reduce that mortality during maintenance and in the recovery period. And I think the recovery period is one of the areas that we actually neglect, because for the simple reason is we get to the end of the procedure, we turn our vaporizer off or stop our anesthetic, and we start to move on to the next procedure. And perhaps there's an important time there to pause to say, how do we look after this patient we've just finished? I know we have a whole list to get through, but how do we look after that patient? And if you have a look at the causes of death, cardiovascular and respiratory are the most common reasons for things going wrong. Circulation and breathing. And those are the areas we actually need to look at and concentrate on, and ensuring that we maintain that cardiovascular and respiratory function. The other areas are not actually that important. We have this big group of unknown, which means we're clueless. It's always that case in studies. But so we're going to have a look more on cardiovascular and respiratory causes that are there. And one of the questions I'm always asked is, which is the safest anesthetic agent? This is just a selection of our drugs that we have. And the simple answer is, it most probably has very little impact. The safest anesthetic is your anesthetist and how safe your anesthetist is. Because if we follow human anesthetic mortality since a long time ago, the introduction of new drugs has done very little to reduce anesthetic mortality. But the introduction of new devices has had a very, very significant impact on anesthetic mortality. So we can see drops in anesthetic mortality because of introduction of pulse oximetry, for example, into monitoring. We can see reductions with the introduction of capnography. And so monitoring devices and looking after the patients actually has the strongest correlate. The drug choices didn't matter too much. And blood pressure, unfortunately, sort of predates all of this, because Riva Rocchi and the Italians introduced blood pressure monitoring in the 1930s. So that was already standard when they started looking at this longitudinal study, looking down the line of the impacts or what has changed human anesthetic mortality. So it's how we look after patients that becomes absolutely critical. We have sick patients, and there's very little we can do about those patients. But one of the questions I always ask all of the clients that I do get to talk to is your dog or is your cat exercise intolerant? I know it's a difficult question sometimes to ask, but it moves for horses as well. Can they exercise, and how do they exercise? Because poor exercise capacity is correlated to bad outcomes. And we've used these tests, by the way, in animals to look at walking tests and how far an animal can walk in 6 minutes. For people, you need to cover at least 400 meters in that 6 minutes. But the less distance you recover, it becomes an issue. And even in this study in dogs, walk distances of just under 400 meters, 384 meters, occurred in sick dogs. Healthy dogs could get well over 500 meters on average of walk distance. So it does help us differentiate and helps us look at anesthetic risk. It doesn't give us an answer what caused it, but your ability to exercise is partially an integration of cardiovascular and respiratory function. And you can see this again, by the way, if you look at, for example, obese dogs have reduced exercise capacity. something that should actually start off with control at puppy vaccines. We're talking about One Health and Global Health, but obesity impacts so many diseases. For example, osteoarthritis. We know that obese dogs towards the end of their life, over 8 years, most of them are going to have osteoarthritis. Whereas if we control their body condition well, right from puppyhood, they've got a good chance of avoiding osteoarthritis, for example. But it does affect exercise capacity. And obesity, we know, or morbid obesity as they refer to it, actually carries anesthetic risks. So it's a question I always ask about exercise capacity to get an idea of how good or bad that is in a dog. The reality is, you don't need a whole lot of stuff. All you need to do is care. That is the most important thing about doing anesthetics and improving safety. Having people look after patients is actually the most important thing. Devices do stuff for us, absolutely. I'm a lazy person. It'll count heart rate for you. It'll give you a number for saturation. But you need somebody to think, interpret, and respond to those numbers, because a machine doesn't do that. As far as AI has got, it doesn't respond at this stage and can't intervene for us. So these are some of the important things to think about. And I've just got a bulldog there because we all know they've got bad airways. They're brachiocephalic obstructive airway syndrome. They should all come with a standard ET tube fitted to them, because they'd be so much better off if they did. But how do we look after patients, and how do we look after them afterwards? And anesthesia has struggled with this since the 1800s, by the way. The first anesthetic desk, Hannah Greener, she dies of aspiration. And with that of course, with her death, becomes the importance of managing an airway. And these two graphs, they CT scans of dogs' heads. The one's a normal dolichocephalic type dog with a long nose. But you can see the ET tube in place there, just below the yellow. And you can see a nice patent airway. The dog below that one is a brachiocephalic, but there's no patent airway in that dog. And one of our duties as anaesthetists is to ensure a patent airway. You don't necessarily need an anesthetic machine. The dog at the top's not connected to an anesthetic machine. It's undergoing total intravenous anesthesia. It's got an ET tube in place to protect its airway. And it just helps protect that airway. And the other side to that is when patients wake up, can they protect their airway? How long do we leave that ET tube in? And if you do a lot of brachiocephalic dogs, they're quite popular in our own country, that ET tube stays in until the dog doesn't want the ET tube. That's the most important part, by the way, is that the dog doesn't want the ET tube. But to leave it in place for long as that dog needs it to maintain a patent airway is absolutely important, especially in the recovery period. Don't get impatient and just pull the tube, because the airway can obstruct. Think about cats. Cats struggle with their airways, especially after they've had dentals. They can get laryngospasm. So we need to look after those airways and check that they can breathe in the post-operative period. I love old literature, and this is all about doing thoracic surgery on people with room air, by the way. So it comes out of the Regional Society in 1959, but it highlights some important things for us to think about in reducing anesthetic mortality. And the fascinating thing is they accepted saturations below 90 at this point in time. But what they did realize is that when patients weren't ventilated well, their saturations dropped. Anesthetic agents reduce tidal volumes. And I don't know what the situation is in your country. If you're doing room air, that's great, because you get a far better and quicker idea when tidal volume drops. But if you're on 100% pure oxygen, like many veterinarians are in our country, and they stop the procedure, they turn the vaporizer off, and they expect the patient to wake up, and they start breathing room air, their tidal volumes are so small that they actually desaturate quite a lot. And that's sort of what's described on this graph here. You'll notice on the top how that saturation graph falls every time there's an interruption of ventilation. Whether it's the right lung or the left lung, doesn't matter. Every time there's an interruption of that ventilation, the saturation falls quickly and sharply. And I think we need to be aware of this, especially when we wake patients up. The one thing is, are they breathing? But are they breathing adequately to maintain saturation? And that, of course, we can look at mucous membrane colors. because below about 70%, we all should see cyanosis. So we're all going to see the things that are catastrophic. And if they start to turn blue, then what we need to do is improve ventilation. And that's essentially what I wanted to show you on this little study here. It's a percentage of ideal or standard tidal volume versus arterial saturation. And when your tidal volume is sitting at about 100% or essentially normal, saturations are well maintained and they're well. But as they fall down, so hypoxia becomes evident. Arterial desaturation falls down. And that's actually critical for us to look at. So it's important for us during anesthesia, especially if you're doing it all on room air. Your patients, if you do have a pulse ox, they're quite cheap to get. These days, if it starts to fall, ventilate the patient. Even if that's using an ambubag with room air, breathing into the patient's ET tube, you can do it with room air, it will improve. And if you improve tidal volume, saturation will improve. But also think about that in the recovery period. Patients who are very deep under anesthesia, waking up will have very small tidal volumes. And if they're breathing room air, they're very, very likely to desaturate. And I don't know what your guys' exposure is to measuring blood pressure, but blood pressure is important. And what we know is that if you can keep mean blood pressure above 60 to 70 millimeters of mercury, you reduce mortality. What's great about this study is it doesn't make a difference whether you do it invasively or non-invasively. But not all of you are going to have blood pressure devices available to you. How can you do it? It's actually quite easy. Can you feel a femoral pulse? And you should always be able to feel a femoral pulse. If you can't, you know you're in dire straits. Can you feel a peripheral pulse? So a dorsal pedal pulse or a radial artery pulse. Because if you can feel those pulses quite easily and comfortably, we know mean blood pressure is above 60. So it's a poor way of looking at blood pressure, but it's a very easy way. When I anesthetize patients, I often don't have these devices. So what do I have? I have my hands, my eyes, and my ears, and I can feel a femoral pulse, move my hand down the leg. Can I feel a peripheral pulse? Yes, I can. Great. Blood pressure is okay at this stage, and I can carry on with what I need to do. So we do need to look at it. And just to show you how important blood pressure is, having a normal blood pressure some of the time and having a bad pressure at other times, it's that bad blood pressure the other times that actually determine our outcome. So when you've got sick patients, doing one blood pressure an hour may not be very helpful. But if you've got patients, people looking after patients, they can feel all these pulses, they can feel for warm peripheries and so on. And you can actually keep a very good handle on blood pressure. If you have the devices that measure it, what's useful to do is to measure a shock index, which is essentially the systolic blood pressure divided by the heart rate, or the heart rate divided by the systolic blood pressure. I never remember the order, but it doesn't matter. It forms a ratio. And that ratio needs to be between 0.8 and 1.2. So if your blood pressure is 120 and your heart rate's 120, that's normal. Your heart rate's 180 and your blood pressure is 120, that's abnormal, especially if there's no reason for that tachycardia. But if you're so tachycardic because of stress, you're scared, the dog is scared, for example, the blood pressure should also be high. It should have 180 as a heart rate and a blood pressure that's close to 180. So that ratio should be maintained. So pay attention to it, and it's very easy for us to check it on devices, and it is correlated to badness. So they refer to it as a shock index. The reason it's referred to as a shock index is our method of compensation for shock is through sympathetic tone. Initially, we vasoconstrict, and then we become tachycardic, for example. So we up our heart rate, that is there, we'll vasoconstrict more. And blood pressure is maintained until all those compensatory reflexes are gone. And once it's gone, it falls, and it falls incredibly fast. That's there. So this comes down to the practicality of it, and what can we practically do to assess our patients. And this little table, in actual fact, comes out of sepsis studies in experimental patients looking for signs of shock. And they say no shock greater than 3 variables normal, or a systolic blood pressure above 90. So just remember, between 60 and 90, we may not be able to detect that with detecting peripheral pulses, but certainly we can detect a pulse less than 60 by not feeling peripheral pulses. But what do they look at? mucous membrane color, capillary refill time, pulse quality, heart rate, and temperature. It's really the simple things in our patients. That's actually what defines it. And we need to get into that habit. Do patients have warm ears or cold ears? Warm paws, warm peripheries, warm tails? And we know perfusion's good. If it's all cold, that is bad. Capillary mucous membrane color. White mucous membranes are bad. Those are usually vasoconstricted mucous membranes. Sign that there's dramatic compensation going on inside that patient. But the early signs, for example, may be that what we call hyperdynamic shock, bright pink capillary membranes with very, very rapid capillary refill times. In the early stages of shock, it appears like that. And then later, or as the shock continues, the capillary refill time gets slower and slower. The mucous membrane colors changes more to a whitey, darky, bluey, gray type color for us. So we know that that's associated with badness. And the peripheral pulse quality is two things. If you feel a nice normal pulse, you feel that, I'm going to just use the lub-dub, but you feel the pulse come through and it disappears. How does that pulse feel? Is it sharp and rapid with a fast heart rate? The systolic and diastolic almost seems to merge into one. You don't feel it very well. That's poor quality pulses. So we can look at these things very, very easily for ourselves and use them to actually assess our patients, both in surgery and when they're busy waking up. Because when anesthetic agents destroy sympathetic tone, and of course, as you wake up, you get this massive surge in sympathetic tone, which changes all of our physiology in our body. And so we can have a patient that's doing really well, and during recovery, things change. And we need to react to that whilst they're recovering. And that's why I say the most important thing that we ever do is to have a dedicated person looking after a patient. That's the most important thing. Hands-on, looking after, get the patients warm. That's absolutely vital for us to do. And this is just a study, comes out of one of the veterinary studies that I came across. Blood pressure is one of the minimum standards that's across the whole world. It's not always that devices are that easily available for everybody that's out there. But by looking at a combination of pulse oximetry, capnography, and blood pressure, you can detect 93% of adverse events. And that means we have something to respond to and to treat. And capnography is expensive, unfortunately. Of the devices that we have, it's the most expensive device that normally most practice will buy. But certainly blood pressure and pulse oximetry is quite easy. And as I say, when patients are breathing room air, the pulse oximeter is actually quite a good marker of respiratory function and how well that patient is breathing. So we can certainly use that to pay attention to both of those when our patient is busy waking up and to see how they respond. And this requires us to do two things in actual fact. We mustn't rely on our expensive monitoring equipment, but what we need to do is train the people who look after our patients. That's actually the most important thing we need to do. Teach them what all the different things mean and what the changes mean and how we respond to them. So that's why you create a record, an anesthetic record. That's not so that you can defend yourself if you ever get sued, so that you can actually look at what's happened over time. Has the heart rate steadily risen? How have the pulses changed? What's the depth of anesthesia of that patient? Because if they're getting too deep, that becomes a problem and an issue. How do we wake them up? How can we change their anesthetic depth? And that training of those people is actually the most important step for us to reduce eventually anesthetic mortality, is the effort we put into training the people who actually look after the anesthetics. Because if you look at a lot of small one-man practice, the person doing the surgery is the anesthetist and everything else. And you just can't spend your cognitive time wondering and looking after the anesthetic whilst you've got a surgical procedure to do. And so we depend on other people around us and how well they trained to in actual fact have an impact. This, by the way, comes from one of the first heart transplants that was ever done. That's the surgeon looking after his patient with exhausted staff in the back there. that is there. You'll notice an ICU didn't really exist at that point in time, so the patient was left in the operating theatre. They made that the patient's ICU to look after those patients. And so we need to do the same. Make a plan to make something work. And with that, I just want to say thanks very, very much for the opportunity that's there. I'm going to stop sharing my video of my feed for questions. I'll turn on my video feed. There we go. Okay.
Thank you, Dr. Kenneth, for your nice presentation. In fact, your presentations were appreciated at our World Veterinary Association Congress too. And we definitely look forward. If there is any question, then we can take it now. Dear audience, any questions?
Chats, they're usually somewhere there, yeah. Then they're welcome to put them in the chat if they would like to, or wherever.
Okay. So I think we can take it later. So
Yes.
may I invite, may I invite Professor Dr. Indramani Nath, the head of the Department of Veterinary Surgery and Radiology, College of Veterinary Science and Animal Husbandry, OUET. And he is also the Vice President of Indian Society for Veterinary Surgery. He has a good clinical experience in wildlife. And may I invite sir? Dr. Nath.
Thank you, Bimal.
Yes, sir.
Respected esteemed World Veterinary Association President, Secretary, President and Secretary General of Indian Medical Association, and Dr. Kenneth, and my Dean and member of the SAARC Education Committee, Coordinator, and Dr. Bimal. So here I am privileged to share my clinical experiences while treating with the wild animals. Especially I am treating the wild animal all over Odisha. If my PowerPoint is visible. Hello?
Yes, sir. Go ahead, sir.
I am treating especially the wild animals here in the eastern part of the India, the state of Odisha. Here, the basics principles of tranquilization, because of a wild animal means we have to go for anesthesia because it involves risk to the personnel and the animals, and one should be very finer in using the proper drug and the equipment for purpose, and he should have the sufficient knowledge of the specific animal, its physiology and anesthesiology. So it is essential that any person dealing with wild animal, he must be a responsible person for the immobilized animal. If he is not able to take the responsibility, he should not do that. And our main motto is to do the process with the least amount of injury or pain or stress to the animal. Because with the veterinary surgeons, though we know the basics and the techniques of giving anesthesia to the wild animals, it is not always we should give the anesthesia. Here we can see one elephant, it is in the mosque, but it is controlled by its mouth, and we are able to trim its tusk without giving anesthesia, the physical restraint. So my purpose of telling that if a captive elephant are controlled by the mahout, if minor process can be done without giving anesthesia. As the wildlife treatment is always associated with the anesthesia, pre-anesthetic examination is essential, but this is possible in case of the captive animals, but in case of the wild, there is no chance of doing pre-anesthetic evaluation. And while we are giving anesthesia, we are most commonly use two terms, tranquilization and sedation. And here, in tranquilization, it is a behavioral change, relaxed but aware of the situation, whereas in case of the sedation, animal is a little bit more depressed and not aware of the situation. And here you can see the one bull elephant in mass, and I'm giving anesthesia handheld because it is in sitting posture. So the always the surgeon should be very quick in reaction. It is in mass. Mounts are fearing to go close. So the forest officer requested to strip the elephant and to trim the tusk. So though I was having the gun and medicine, but I see it was hitting. So about 8 ml of anesthesia I have injected using one 10 ml syringe, and 16 gauge needed. So quickly I approached the animal and immediately injected the immediately 8 ml, and you see by the time the animal is standing, I am away from the elephant. And this is the
Professor,
onset of anesthesia.
can you just make it full screen? We are not able to see the full screen.
Okay, sir. Okay, sir. Is it fine, sir?
Yeah, now it is fine, sir. Yes.
Here I am. So this is the quick response. Immediately, it is not allowing the mount to go close. So we have to strip the elephant, trim the tusk. So here I have administered anesthesia so sharply, and this is the onset of anesthesia. And here we are trimming the tusk. It is in you see one thing here we have forgotten. The animal, the elephant is tranquilized, but one mistake it is forgotten. We should have cover its blindfolding. It should not see because it is aware. Some people are standing and doing some job. So this is a different step. So this is always in Indian this Asian condition. We do standing sedation, same gelatin and ketamine anesthesia. And here the animal is standing, knowing the things, but it is less risk to the animal. We are doing our job very nicely. Next, in non-cooperative animals, remote drug delivery system by using the dart guns, pole syringe, blow dart, this is commonly used, and this is, and while going to treat the elephant, this is most important. This is anybody should not run straight in front of the elephant because this is 67 degree. This is having the binocular vision. Elephant is easily seeing with both eyes, whereas this 123 degrees centigrade, this is the uniocular vision. This left eye is seeing this area, right eye is seeing this area. But this 67 degree is by both eyes it is seeing. That is why never run in front of the elephant within this angle. And it is interesting to mark here where Mahout is sitting 47 degree, it is a blind spot. That is why when Mahout is sitting on its back and giving command, you do that, this, like this. And here in our condition, it is we are tranquilizing the wild animals in the forest by guns, but here it is very risky because we cannot use an helicopter. Of course, you can use because this is a dense forest and it is very difficult to dart unless we go very close to the elephants. But in some states of India, punky elephants, trained elephants are being used for darting, tranquilizing the elephants. Here you see, here I'm sitting, my assistants, they are stand here. And meanwhile, the elephant came. I cannot fire because it is approaching me. So I stood here confidently, and my attendants, they make lot of sound, excitation, firecrack. When the elephant went back, turned the side, I could able to fire. So this is the different stages of different elephants are being tranquilized. Here, both all are in standing situation, so we are in a very safe condition. And this is very tragic event. I want to show you the video. You see, here is the elephant. Here, the doctor is here to fire, but he should not do this because the elephant is clearly saying, and it is a clear area. That is why he could not run. Elephant went chased him and killed. That is why this is the you should not see once the elephant see the who is the charging person, he should keep away, or better he should not do the darting or giving anesthesia. This is it killed the doctor by goring. This happened unfortunately in the Karnataka state of India. These elephants they are tranquilized in standing situation. You can see the multiple injuries. Here we have treated very successfully. So this is the means if you are good doctor, know the physiology, pharmacology, drug, and you should be a very adventurous person. That is why the wild animal is a combination treatment is combination of art, science, and adventure. And here, coming back to the largest animal, they have strong heart instinct, and you can see this tusker is having one injury in here, and how the group they are giving protection to this. And I had approached this elephant, and when it charged, I have righted one hillock, and I could able to fire. But I am fortunate the elephant could not drag me out of a small hillock stone because it is having some injury, and then I could able to fire. And then dressing down, because I have applied it retention sutures, but the maximum mobility organ is the trunk, so there was wound lesions, but still the elephant is living with this cut trunk. And another point here, the mother and the baby instinct. You can see this baby is having multiple abscess, so we have to drain it. That is why we tried a lot, 2 hours, we could not separate the baby from the mother. So I have to give anesthesia to the mother, then to the baby to treat the different wound. And here the mother is standing and the baby is anesthetized because it is a small baby. Doctors, other helpers are putting it in standing, support it is in standing condition, and I am treating the elephant. This is the usual darting site. Usually always we approach from this back region, and once it is tranquilized, the first dose, I usually use 5 ml syringe darts, 300 milligram of xylazine and 200 milligram of ketamine administered. And if any additional, I usually prefer to give in the handheld syringe like this. And you can see this elephant is having one tire stuck in its foot, and we have removed. These are the multiple this abscess drainage. This is the bullet wound treatment, and this is another dressing of the wound in case of the one elephant. And this elephant human-animal conflict in one night killed 5 persons. So there is a lot of pressure on the forest officer. They requested our team. We have tranquilized it, and here I have to mention because of the last night it has killed 5 persons. It was so excited. even 2 dart of xylazine and ketamine failed, then I have to administer the immobilar, and though it is a long back expert, but it still works, and you could able to keep it in standing sedation, blindfolding. We have trimmed the tusk, we have chained it, kept in captivity. And this is last month I have visited the forest that is now being given training, and it is to be used as one punky trained elephant. As Dr. Kenneth was describing, giving anesthesia is the most important, maintaining the airway. That is the most important thing. And giving anesthesia to the wildlife is an art, and there is no substitute for experience. As in domestic animals, we must maintain all these things, as mentioned by Kenneth. And the most important drug in the series giving anesthetizing the wildlife is the opiates. And this is the latest one, the etorphine hydrochloride, and its antidote is naltrexone, 9.8 milligram of etorphine hydrochloride. This is very potent drug. You can say after giving this the dose 10:1 or some even 10:20, and for carbendazole 1 milligram of drug, and the antidote for the horse is 100 milligram. The antidote is to be used. And this is Captivon. We have administered Captivon. You see the complete recompense of the elephant. And here, because it is a healthy elephant, we have our purpose was to apply one radio collar. So this is the blindfolding. But in xylazine ketamine, the elephant will remain standing. And this is in Captivon administration. The elephant is in total lateral recompense. And this is the immobilar, but nowadays it's not available. We do have very backlog in Lanka and Zoo. Even if it's expert up with the expiry of 10 years, it is working. And these things all we know at the basic anesthesiologist. And here it is an interesting observation. This was a male Makhna, tusk-flexed male in Chandaka Elephant Sanctuary, Odisha. It was in mosque, broke its chain, intruded into the nearby village, killed the people. It was tranquilized, came back, took back to the sanctuary. But when it was again, after recovery, it was again about to break the chain and intrude into the village. So it was darted with immobilon by the doctor. And you see, because immobilon was administered, animal is moving, doctor is in panic, it has killed the people. So in the process of darting, the dart was not injected vertically. Intramuscular injection, it was subcutaneous. As you know, opiates, once they are underdosed, slow absorption, excited, it broke its chain immediately, because this was off-fed, very intelligent animal. It know where is the feedstock room. Immediately it went into the feedstock room, broken its door, and started eating. It was in moth. You can see the secretion of the moth plants. As you know, anesthesia started working, and while it was eating, there was a choke, and subsequently there was the death of the elephant, and this is the postmortem congestion of the brain, and there is the food, aspiration of food. This is a very tragic event which happened accidentally. And we have observed some bizarre reaction. Even if we have given immobilon while doing testing, the degree of sedation, it immediately woke up and went back into the forest. Some of the cases, because maybe excitation or sudden stimulation. These are the traditional drugs we are using. Indian products, always imported products. But one observation here, previously from trial laboratory Australia, drugs are available now. You could not get it. This is the yohimbin, the antidote, partial agonist antidote. And here, another very good case study. This elephant was in Nandankanan Zoo, and it has killed its mount, and it was kept under chaining several years. In 2009, our government decided to give training. So it was to be shifted to one training class by physical restraining, by using the Kunki elephant. Then subsequently by giving anesthesia, shifting was not possible. Then they requested the college people. I went there. I have administered anesthesia, and here we have lifted it in a crane, loaded in a truck, and started proceeding. But after going few distance, the elephant leaned to the one side. So there was a lot of pressure. So I thought to decrease the degree of sedation by yohimin. But while giving, somebody pushed me from behind, and I thought to decrease the degree of sedation by administering 0.5, about 2 ml was injected, and immediately animal revived from anesthesia. And you see, the lot of people, the public media were going, then it completely recovered. So what to do? Then it was moving, it was taking it strong to the cabin, so driver ran away. Forest officer told me, giving me a lot of pressure, doctor, now you have to drive the truck like this. So I was on severe pressure. Then I have administered additional dose of xylazine and ketamine by how to, because the animal was moving, there's loosen out his chains and the ropes. So I told his mahon, and this is the mahon, he called him by name, so it is responding. So now it is static. Immediately I administered additional anesthesia, and we could subsequently able to transport to the site. This is the while downloading, because you can see because of struggling on the truck, there is a injury to the tusk, bleeding, or the losing of the ropes and the belts. So on reaching the site, the forest people requested to clean their tusk, subsequent fluid administration. So I got a lot of praise from the government, a lot of award. But while I was presenting this paper in one national conference, Dr. Klaus and vet advisor to Thailand, he gave one positive comment to this event. He told that, doctor, you have given anesthesia, then reversing, and then you are giving anesthesia. So you are lucky that your elephant has not gone mad. This is a very good observation. And this, as we discussing, we are showing the field veterinarians, our students, downstairs of anesthesia, relaxation of penis, trunk, resting on the ground. And while you are giving anesthesia, you all we should do in the shade area. In scorching sun, this is a sunburn photosensitization. If phenothiazine group of drugs are used, you can see this type of sunburn. In elephants, wounds heal longer time, so you will live under stress. And while giving anesthesia, just Dr. Ken is saying, this is the baby elephant pulse oximetry we are doing. Standing sedation, this is the tongue. We are applying the probe of the pulse oximetry and the white baby. This is the what I was talking, that is the antidote agonist property, but this is pure antidote. Nowadays that trial laboratory Australia preparation is not available. So this is another preparation, though it is having same 100 milligram of the content, but it is not so much effective. Maybe something, this is the point to be noted. Maybe in the dilution process, something previously I was using 5 ml that, nowadays 7-10 ml that to tranquilize the elephants. This is the ketamine. And here another case, in Odisha, those days during 2009, these Naxalites, the Maoists, they have invading the forest beach house in the middle of the night. So this elephant was there. He trumpeted. So they fired the bullets. You can see this. We went from the college, tranquilized it, and one interesting observation, though we have administered xylazine and ketamine, heavy dose, but still it is moving its head. So how to go close and treat the elephant? So in addition to the chemical immobilization or drug administration, I told one of the doctor to keep this tripod anchors, because this is the combination of physical and chemical restraint, and you could able to remove these small pellets or bullets, and antibiotic administration, routine treatment, and elephant recovered very nicely. And some post-mortem cases, this part of Odisha, Many times these types of on the postmortem examination, the poachers are using this long stick attached to a metallic object and thread they poisoned with maybe having from northeast. They have some connection that the people was arrested for killing the elephants. This is an postmortem observation we are getting this. And this is several cases of elephant treatment in the field, multiple bullet injuries in fighting injuries, and metal detection. Here we are doing all this because it is sick animal, immobilian or any opiates, it is very dangerous. So Jali jinki time standing sedation and we are doing the things. And this is in captive elephant, multiple, because of tying in most condition, multiple chain injury, same sedation, blindfolding and trimming, changing the chain to other limb, to the healthy limb. This is the usual. This is impaction in one elephant. To administer fluid, we are giving dosing by using one Tolu AC motor pump, submerged in the water can and administering dosing, and fecal balls we have removed successfully to improve the health condition of the elephant. And this I have already told you, one because of nowadays, because of the tourists, they are moving into the forest for the this lot of garages are there. They piled up the tires nearby. So while elephant was passing on a tire was stuck its limb, and we are able to remove it very successfully. There was a sprain of the elephant in the forest. We have taken the X-ray by portable X-ray machine, and to keep some maybe 1 week here the POP application, because there was minor strain, and we could able to get a very good results. Some degree of immobilization for few days, and when elephant entered the water, it was removed. And this type of strangulation, you can see the strangulated rope we have removed. This is in standing sedation, blindfolding, and while we are doing the work, we should very careful, because limb, we don't know, elephant may give a kick, may sit down, so there is always a risk to the doctor and the personnel, but it is less dangerous to the animal. It revives very finely because it is in a standing condition, because heavy animal, once it becomes recombinant, it is very difficult to lift it. This is different strangulation injuries we are treating very nicely. And this is, you can see, we have removed one cloth where this was retained in the limb. We have removed by standing sedation. Very difficult situation is fracture malunion. It is very difficult to treat. And here is one very interesting observation. One baby elephant in the heart, it was detected by drone, and it was brought to the hospital. You see on the X-ray, we could able to see there is dislocation, and you see the condition. Only very small portion was attached. So we have very carefully tried, because it was between the joints. Our main aim was to bring the adhesion between these two edges. So here, by applying in opposition by one splint application, repeated suturing, and we could able to get the success. And now it is in the Nandankanan Zoo, and you can see how we are using high technology. And you can see the elephants while the baby is, you see, we detected this fast in the drone, and you can see on the lame baby elephants in the drone, you can see here in the below slide, and one of the mate is giving support. And this is the elephant. It is the baby elephant. It is lame that we have treated very successfully, and this you can see. We designed the device like this, and this is about 2 months back picture. Now that device is removed, and it is in our zoo and living the normal life. This is a great achievement. So in wildlife treatment, we should never be panic. You should do very cautiously, very patiently. You have to do the thing. Definitely, one doctor can get the success. And this is as a professor, I am always taking my students to involve in the process. This is the wound dressing, tranquilization. And while we are giving anesthesia in the forest, always we move with some poles, ropes to keep the animal in standing like this. It should not sink. Once it is recombinant, immediately attempt to make it stand by using some pulleys in small baby elephants, subadult elephants. But in large massive elephant, we have to use the crane, lift it, and can make one platform like this, and you will definitely have the success. This elephant developed multiple bed sores by the recombinants. Immediately we could plan to get it stand. So here by using conveyor belts, we could keep it in standing. And this is the process of lifting. And elephant first in sitting posture, then standing, and after 1 month, there is you see the beauty of this. It is able to stand, walk. So immediate intervention is required. And if in the process of treatment, if some elephant get recumbency, so immediately you can see it is a tusker. Heavy thing is the elephant is the head, and you must lift it. So we are tying this, we are applying one rope in this tusk, and using this tree as the one pulley, and they are pulling. So head is raised, other persons are giving one pole as a fulcrum, and it was brought to the sitting posture, and you see the beauty how immediately because we are trying immediately of recumbency, so it is standing. So this is the process, and you can see previously we are lifting the elephants by using conveyor belt, but because there was a chance of slipping anteriorly or posteriorly, so nowadays we are using 4 leg strap. 4 legs we are applying this, and we are giving some anesthesia, rogue elephant or human animal conflict. We are tranquilizing, standing sedation. Then by 4 strap we are lifting it, lowering in the plane, and we are leaving in the desired forest area. Like this is the loading, and this is how we are applying 4 strap and then lifting in the crane, loading in the truck, and here the downloading at the area of its natural habitat. So this is in standing sedation, we are using the same gallium anesthesia. This is another elephant being treated in the forest. This is so many impaction we have treated. This is tusk trimming, and this we can see one wound was there here. The portions of had bullet. I have tested metal detector, standing sedation, would able to remove the bullets. And here one interesting observation. Forest officer, they told that one elephant with a distended abdomen and some contents are falling from the abdomen, and because they are not able to go close, they are thinking it is pregnant and some discharge there from the vagina. But when I went there to treat the elephant, when I darted, the penis came out. So it is a machna. So it was not able to mate. Other alpha males are not allowing. So it was sphegma deposition in the sheath, penile sheath. It was just feeling some pain and walking abducted way. So this discharge was falling. So my job was done very nicely. Once started, the penis came out of the sheath. I could able to spray the water, the antiseptic work, antibiotic administration, and it is fine. In case of the Jews, we are detecting using our ultrasound machine to detect the content, if it is a pus or sheath, and we are draining. And these are the things. All we were doing. This one baby elephant trunk injury is some completely anesthetized lateral recumbency baby elephants, and you see the healing this. And some baby elephant rescued, multiple beds we're taking X-ray to rule out any fracture dislocation, the proper care, physiotherapy, and the feeding, and you see this is the rehabilitation. And in the healing process, always we have to first remove the these scars, otherwise it will drag and make the wound very big. So 1 degree rise of temperature in elephant is fatal. So immediately after the intervention, we spray sufficient water to cool the bloodstream. Similarly, in case of the winter days, the baby elephant, it is separated from the ark by this gunny bag, then heating. Different processes, taking X-rays, brain, arthritis, we are ruling out, and this is one complication of FMD vaccination, multiple swelling following FMD vaccination, and automatically they shrink down. Never give because of compulsion from the forest officer. I opened one, nothing to get, but a wound healed take about 1 year to heal. So this is normal in some elephants. Swelling, cellular swelling is common in elephants following vaccination. And this is one interesting observation, temporal gland temporary, and you see we are draining it, and because it has got a fibrosis, so I had removed in standing sedation from this tusker, I have removed the secreting membrane, and it happened to be one myxomatous fibroma, but continuous dressing, and the wound healed, and now it is having the normal life in the Chandaka elephant sanctuary. In case of the foot injuries, we do this cryotherapy and some studies, and this is the important of my observations, and I thank the SAARC Regional Committee, the President, for giving me the chance to share my experience. Thank you all.
Thank you, sir, for nicely presenting about the wildlife anesthesia. In fact, it's a not only the technical expertise is only required, it also needs a lot of courage. So thank you for venturing it. I think we can take the question answer later. Sir, you can close your presentation. So without further delay, I would like to invite Professor Dr. Rakesh Garg, sir. He is a professor of anesthesiology and critical care at All India Institute of Medical Science, New Delhi. He is also the editor-in-chief of Indian Journal of Anesthesia. Indian Journal of Anesthesia is the journal of ISA, Indian Society of Anesthesiologists. More than 20,000 human anesthesiologists are there, and it is one of the largest anesthesia association in the world. So he will throw some light about the advancement in anesthesia and also the importance of publication in anesthesia. Dr. Professor Rakesh Garg, sir.
Thank you so much. Sorry, a little disturbance from the background. I'm at airport right now. Got late. So thank you so much. I was just listening to last few sessions. I'm really very impressed with the good work that you all are doing with providing the best anesthetic care to the all our people, the creatures around, and you're providing them so comfortable. I'm so happy to see those things. So when you talk to me regarding that, what new novelties are going on, I think I was just today itself I was discussing to one of my pediatric surgeons, and they also were looking for learning some new techniques into the animal models. And when we talk about the animal models, we are sure that on one side we should be a little considerate about those using models, and now we are moving towards shifting them to not the animal models, but we are actually using a lot of simulators and simulations in this practice. And when we talk about teaching and training of anesthesia on simulators, I think this is what the recent things have come up. And I have come up with a full dedicated issue in Indian Journal of Anesthesia also on simulation and simulators and use of technology. So I think this is what the crux is. In earlier old days, we used to practice a lot of things on the actual patients. or maybe the animal's hair, and then we try to look for what impact does it have. Maybe it was related to the drugs, it was related to the technique, or is it related to the use of the equipments? Maybe anything for the regional blocks, for the area management, for resuscitation. So we were using those models earlier, but now with the development of a lot of simulation and giving them a realistic touch, a humanistic touch, we are able to do a lot of things on those simulators. I was just wondering that whether these type of simulations would be of some use in the veterinary science. I hope it would, because it will allow us to understand that how this new technology can be used more safely. As I was looking in the last session of yours, uh, they have been a lot of interventions being done on animals, whether it is trauma, whether it is some disease, whether it is also related to say safe delivery of these, or the subsequent complications or abscess you were talking about in the foot of the elephant. I think we need to look for whether we can translate into the simulation. And in the human practice, yes, now we are moving away from learning directly to a novice on the actual patients, but moving on to the simulators before a novice enters into the anesthesia practice to learn the things on those simulators rather than the patients. And with the introduction of artificial intelligence now and the technology being advanced, these simulators have really advanced. Couple of years back, these used to be the skill learners, or we used to say that the simulators that were had in the form of mannequins, which were more of a skill learning. But now a lot of technology has been put into this system, where it started that they will behave more or less in many aspects like a real human being, like a real human patient. And now with the advancement of the artificial intelligence, it is also picking up the performance or the reply of the persons who are working on these simulators. And this is a really a big boon when we talk about the learning process. This is also important for learning skills, but more importantly, it is also giving a platform where the team dynamics and the strategy is also important. Say sometimes in a calm environment, we may not be able to perform the same. But if some complication happens, some mishap happens, the panic situation or the panic environment that is being created there, that can all be simulated nicely. And with the advancement of the artificial intelligence, the performance, the behavior, the face recognition of the participants are nicely picked up. So I'm looking for that these type of technology will be a boon in learning, teaching, training, and bringing the youngsters on a robust platform before they actually come into their clinical practice, whether it's human or veterinary. And so we are looking forward for these aspects. Second aspects that we are looking for is the safety profile of the drug. I was just listening the tranquilizer drugs that you have been using, and I'm sure the anesthetic drugs must have been used in the same way. Now we also have certain drug delivery systems which has come in the recent last 2-3 years, which identifies the requirement of the patient and gives the exact amount of the drugs. We want our all patients, whether humans or animals, to regain their consciousness, to look for whether there have been some side effects. And the earlier they regain their consciousness, better we feel, because maybe we have done some intervention and we want to look for its performance, for its after effects. If they regain consciousness faster, I think it will be much easier for us to look for the effect, immediate effect of the intervention that we have done. And these drug delivery systems has again been integrated in various technology. So this usage of technology and the presence of newer drugs, which are shorter acting, predictable impact, and faster recovery. These again are giving us a lot of benefits for not only increasing the turnaround time, but if some patient has faster regain of consciousness, the turnaround time also increases faster, and probably the morbidity also comes down, because we all know that the increased duration of anesthesia is directly related to more increased amount of morbidity, not mortality, but at least morbidity. And if we can come down, I think that's very interesting. And third point, which I just want to highlight, I'm sure that you as an expert in veterinary science will also look on those arena, that when we give anesthesia for any type of surgical procedure, there is a lot of impact of the cognition and delirium. The post-operative cognition and cognitive dysfunction and delirium has been seen in a specific subset of population, like elderly patients with comorbidities, with some amount of prolonged major surgical procedures. And when somebody have cognitive dysfunction, it leads to an increased amount of delayed recovery in these patients. So I'm sure that same feature would be applicable in veterinary sciences also, that if the recovering animals have prolonged recovery, if they are not able to understand their environment nicely, probably they will be harming themselves, or the creatures around them also may be harmed because they may not be able to judge the right behavior in their existing environment. And we have been quite cautious to look for this, the early detection, the preventive strategies, and the management strategies. I'm sure that this will be translated. I'm sure that you all must be working on those areas also, that though we will be able to provide, say, abscess, okay, the fracture treatment or some other structural disease, but is our intervention of anesthesia in these patients, in these creatures, have some impact there on their cognition? Are they able to go back not only structurally intact, but also cognitively intact? So I think this is, again, an area which we are looking into anesthesia practice from the human being point of view. I'm sure this may be an interesting point to look for from the veterinary sciences, because a healthy creature thinking appropriately back to their hometown in a jungle or wherever it is living, they behave in the similar way as before they underwent the surgical procedures. I think these are the recent things we have been looking for in the anesthesia practice. More is coming up, more safer anesthesia practice is coming up, but still a long way to go. So this is what I believe, the use of technology, the use of artificial intelligence, the concerns about the cognitive dysfunctions and delirium in the immediate post-operative period and its residual long-term effect, and also the inclusion of the simulation is a boon, where we cannot use animals as an guinea pigs for research purpose. If we have simulators, probably not only for human practice, but probably for animal practice also, these type of simulators will be a long boon for creating a good teaching, learning, and creating a veterinary experts in future. So I think these are a couple of things from my side, and thank you and best wishes for a wonderful conference. I'm so happy. I'm joining this expert group of people across the world, especially the SAARC people, and I must appreciate and congratulate. In last half an hour, I think I have learned many things, that you are doing absolutely wonderful work, and my whole best wishes with you all. Thank you so much.
Thank you, Professor Garg, and it was really insightful to learn a lot of things like simulations, cognitive delirium, and especially you have mentioned about the use of artificial intelligence, and definitely we are going to look into it. In fact, our next presentation is by Dr. Matthew Rellard. He's the president of Association of Veterinary Anesthesists and Analgesics. He's also the associate editor of Veterinary Anesthesia and Analgesics. It is one of the unique journal which is actually publishing only on anesthesia. And from SAARC Veterinary Association, we are happy to honor you as an eminent physician of SAARC Regional Veterinary Association. And we will send you the certificate soon on your mail ID, sir. Thank you for
so
joining. And hope we will, together we can publish more articles and we can look forward. So I invite now Dr. Matthew Rellard. He's the president of AVA and the associate editor of VA. Welcome, Dr. Matthew Rellard.
Hi, everyone. Thank you for having me. I hope you can hear me, see me, and see the screen. Is everything working?
Yes, sir. You are loud and clear, and you are perfectly visible.
Good. So I remove my face for this presentation. I'll put it back on in a bit. So thank you very much for having me today. I'm very happy to be here to represent the Association of Veterinary Anesthetists. And I am really sorry that the presentation I'm giving you today is not as fascinating as the one we have heard previously. It's a little bit more about the association and a little bit less about the content. So I just wanted to introduce to you the Association of Vet Anesthetists. This is our website that you can find online, where you can have all the information about the history, about the members, about the trustees, about new insights about veterinary anesthesia and analgesia, and about our conferences. So I'm gonna go through some items of the website with you now. First of all, who are we? Well, we are an active and enthusiastic group of veterinarians and others that could be nurses, technicians, researchers, pharmacologists, human doctors, and what else? So all of those people that do share an interest in animal anesthesia, animal analgesia, and animal welfare. The AVA was established in 1964, so you can see that this year is actually a huge, big birthday for us because the AVA is celebrating 60 years. And it was established to promote the study of and the research into the subject of analgesia in animals. Our vision statement is to be a global authority in veterinary anesthesia and analgesia, promoting best practice and animal welfare through education and research. So we try and promote and support all the activities of all those engaged in veterinary anesthesia and analgesia. We encourage worldwide collaboration and discussion between those interested in the topic. We try and disseminate reliable and accessible resources for all matters involving anesthesia, analgesia, and also topics related to animal ethics and welfare. And we do partner with like-minded organizations to promote the support and support the professional development and advancement of specialist qualification in anesthesia. We also promote the development and delivery of safe and sustainable anesthesia for animals. So the trustees of the AVA, you can find here just the name and the faces, are the people that are elected by the members to carry some of the missions and move forward the association. So we are a little group of volunteers and we are very busy. We meet every month on a Monday night. Well, I mean, it's supposed to be Monday night in Europe. Depending on where people are, it may be in the middle of the night for me, which currently I'm in Western Australia. So I meet with them about 3 a.m. Once a month. And we discuss the topics of the association and how to best work to achieve our mission statement. We have about, let's say, 500 members, probably a little bit more right now. And the members are from many different areas of the planet. Of course, you are very welcome to join us if you are interested. I think the number of countries listed, I must be short by 1 or 2 countries here, and we are nearly operating in 40 countries. So what do we do for our members and for you, even if you are not AVA members? Well, we have a few resources that you can find on the website, accessible for free, wherever you are, from your mobiles or from your computers. And we do have a few useful tools. In particular, we have a checklist, so the AVA checklist, which I will show you in a minute. We have anesthesia records, and we have guidelines for safer anesthesia. So as you know, since a few years now, the World Health Organization in humans has developed a peri-surgical safety checklist that has been shown to improve the safety of patients undergoing surgery. And based on that model, the veterinary world has become crazy and created a lot of different checklists, which we have heard a little bit about beforehand. And the AVA, a few years back, has created an AVA in collaboration with a few volunteers has created a perioperative anesthetic safety checklist, which is freely available on the website. And it takes into account all the different phases of anesthesia before the procedure, before induction of anesthesia, before surgery, and in recovery, to make sure that we think about all the little factors that can have a major impact when safety is concerned. In particular, the care of the anesthetic equipment, the preparation of the anesthetic equipment, the drugs and the equipment, and those patient-specific considerations. So this checklist is very useful, is used by a lot of people now, and you can download it for free on our website. You can use it everywhere. You can diffuse it, give it to whoever is interested. The more it's out, the better for everyone and for animals, because it really increases their safety if it's used. On our website, you can also find different types of anesthesia records. We have essentially two different types of records. Records for high ASA status and records for low ASA status. We know that the records are essential to document the information during anesthesia and to ensure that things remain monitored and physiologic during the process. And it's often hard to develop an own individual record for each and every practice. So the AVA has done that for you. And if you don't know how to record the variables in anesthesia, then that's probably a good way to start working on it. And again, this is a resource that you can find on our website. Don't hesitate to contact us if you need any support or any help to use the tool. Another item that you can find on our resources section is the guidelines for safer anesthesia. They are not recent, they are a few years now, but they are still totally valid. And they are divided into patient safety, anesthetic case planning, analgesia, staff, monitoring, patient support, emergency, recovery, training, and anesthetic records. You have information about the guidelines specifically, and you could find further information for veterinary staff and or for pet owners, because as you probably know, it is also very important to communicate with the owners or the caregivers of the animals about the topic of anesthesia. And interestingly, I was reading in the chat earlier that veterinarians are often blamed to be poor anesthetists. And I don't believe this is true. I believe the veterinarians that do anesthesia and other things are superheroes because they know so much about everything, really. It's quite impressive. I'm totally useless if taken out of anesthesia. So I don't believe the clients can think about veterinarians that they are poor anesthetists. However, I do believe that sometimes we don't necessarily discuss the topic of anesthesia in sufficient depth and detail, and on the AVA website, you may find some information to bring that to your practice too. As a side, the AVA also owns the Journal of Veterinary Anesthesia and Analgesia. The journal is currently a subscription journal, though keep looking at it because it may change soon to open access, which means that you may soon have access to all the content of the journal. It is not quite there yet, but I am really working hard on this, and it is my mission for hopefully the end of this year. Currently, you find a subscription article, so you have access to all the abstracts, but there are sections on the website where articles can be accessed, full articles can be accessed freely. In particular, the editor choice articles that are freely available, and there are a few open access papers as well in the journal. So it's always a good resource when you want to read about veterinary anesthesia and analgesia. Also, and for free on that website, we have podcasts. I think we have, well, I know I'm sure we have 31 podcasts. They are mostly recorded by the Dr. Ludovica Cavaccini, who's one of the associate editor of the journal, and she does a great job. So for some of the articles that you don't want to read, well, they may even have an abstract, a podcast that you could listen to instead of reading the articles. So very useful, very handy resource. Feel free to use it extensively. One of the roles of the AVA is also to promote meetings and future education. So we collaborate. We have a bilateral recognition, yes, if you like, with the NAVAS Society. NAVAS is the North American Veterinary Society. And we do have a bilateral reciprocity, which means that our members can access all the resources of NAVAS and vice versa. NAVAS members can access our resources as well. In terms of meetings and future education, we do partner with NAVAS with their symposium, though I think we may have missed it for this year, but this is an initiative that will be happening again in the future. It was this weekend, and it's probably going on as we speak. The AVA generally organizes 2 meetings a year, 1 meeting in spring and 1 meeting in autumn. Our spring meeting in 2024 is next week in Switzerland, and the following one will be in London in September. Both meetings are available in person and hybrid online, so that if people cannot travel, they can still access the scientific content of the meeting online. If you don't know what to do in September, I'd recommend you join the AVA meeting in London because it's going to be very exciting, given the fact that it is the 60th anniversary of the association. The spring meeting next year will be held in Vienna. We don't have the dates yet, but I have heard from the organizers earlier today, and they are talking about giving us suitable dates by the end of this week so that we can present them in Switzerland. And the following Congress will not be an AVA Congress in autumn 2025, but it will be the World Congress of Veterinary Anesthesia in Paris, and it will be happening together with the Human Anesthesia Society in Paris post-Olympics. So that's also going to be a great and huge event, and we are very happy to collaborate to it. In addition, the AVA also collaborates with different societies, mostly for now in the UK, but we are totally open to any collaboration if you feel we can bring something to you. So we are and will be present at the London Vet Show in November 2024, and we have been for a few years present at BSAVA. Both are very British conferences, but again, this is just to show you where you can find us in English. And should you want some interaction with us for your various societies, because I've seen that in the meeting today, there are different societies from various countries, India, Sri Lanka, etc. We will be very happy to collaborate with you if we can bring something to your countries as well. So don't hesitate to contact us because we are always happy to contribute. And again, providing education and quality education in anesthesia is one of our mission statements. So we are very open and happy to discuss anything. This is just a little teaser about the 60th anniversary again that will be happening in London in September. The meeting will be held together with the Royal Society of Medicine in the UK and the IASP, the International Association of the Study of Pain. We also have an affiliate day to that meeting. So there will be a full day dedicated to pain in animals, which will be absolutely fascinating. So save the date if you're around, and if you cannot travel to the UK, you can always sign for an online version of the meeting, which should also be excellent and interactive. So don't hesitate to contact us about it. Other things that we have in the AVA are a CPD accreditation committee. So if you develop some anesthesia education in your various countries and languages and you want us to review the programs and accredit the trainings, we are very happy to do that. We also have an ethical committee. So if you plan on performing animal experimentation, you know that if you want to publish that in scientific journals, you will need ethical approvals. And sometimes it's a bit tricky to get the ethical approvals. So if you don't know where to go for the ethical approvals, well, the AVA has an ethical committee that is very efficient and very helpful. What else do we have? Well, we are present on social media with sometimes a bit more, sometimes a bit less, but this is always a very good way to get in touch with us. And for anything, really, any anesthesia-related topic where we can bring something, well, don't hesitate to contact us through any of those channels. So AVA website, and you will find on the AVA website all the names and contacts of the people. On the Facebook page, potentially on, it's no longer called Twitter, but I do prefer the icon of Twitter to the X one. So guess what? I will leave it for a little bit longer. Yeah, you can find us on those social media. We are also on LinkedIn now, so don't hesitate, get in touch. And if there is anything we can do for us and to bring some more about anesthesia wherever you are, feel free to contact us. And that's it for me. I'm sorry it was a little bit less interactive than elephant anesthesia, but hopefully you'll find some interesting resources in what I've just presented today.
Thank you, Dr. Matthew Rellard. In fact, I just say, actually, I just called Dr. Matthew. He told, I'm just recovering a horse. What should I do? I'm in the middle of, I told, don't worry, first life is precious and you should go for that. Whenever time will think, I will just ping you. So, whether it is a human life or animal life, it is really, invaluable. We cannot give a price for that. So as an anesthetist, we definitely look for our job first. And these are the things, so, like sharing and caring is the most important thing in this, millennium era. So we got a lot of information and we hope, our SAARC association will be associated with you and we will take it forward. Thank you, Matthew.
Perfect. Get in touch.
Yeah.
Thank you for having me. Thank you very much. It was a pleasure.
And one more thing, we on behalf of SAARC Regional Veterinary Association, we will honor you as a eminent veterinarian of the world. So we will send you the certificate soon. Thank you, sir.
Thank you. Thank you for having me.
Yeah. Next, may I invite Dr. Naveen Malhotra, sir. He is a well-known anesthesiologist in India. He is the secretary of SAARC Association of Anesthesia. This workshop actually is an outcome of this SAARC Association of Anesthesia. When we were looking for a unique topic this year, in fact, we found that there is an association which is working exclusively on anesthesia. And as anesthesia, as Dr. Matthew was telling, you have to explore a lot. So this is a very good platform where humans and animals can work together. Rather, in lot of experiment is needed in animals. So may I invite Dr. Naveen Malhotra, how a collaboration can be a medical association and veterinary association can be done, and what is his perception on it? Dr. Malhotra, sir.
Thank you, Dr. Vimal, for this kind invitation and introduction. And I will convey my greetings to SAARC AVA and on the World Veterinary Day, which happened to be on 27th April. So, greetings to all. I am Dr. Naveen Malhotra. I am the Honorary Secretary of SAARC Association of Anesthesiologists. And I was immediate past National Secretary of Indian Society of Anesthesiologists, and I'm based at India, northern part of India in Rohtak, Haryana, and I am I was just retired, taken VRS as senior professor and head of the Department of Cardiac Anesthesia and Pain Management Center, and I've started now. I am director of APMC As Pain Management Center, Rohtak, Haryana. So I've to be honest, this is a new thing for me also, and our association is open to collaboration for any academic, clinical, or research activity. Per se, I will be honest to confess that My anesthesia experience and our colleagues across the country anesthesia experience is limited to human beings only. So this is a new field for us, and I think we can collaborate for safe anesthesia practice. And whether it is human beings or whether it is animals, as already emphasized, that life is important. So any life on earth given by God is important, and whatever we can do to safeguard that life and conduct a safe anesthesia practice, not only in humans but for animals also, is most welcome. And I think it is our responsibility also towards that. So, Dr. Bimal, if there is anything we can collaborate, we will be more than happy. I'll put it across to my board, to our president and other members from SAARC countries, and we can explore that idea. We usually work as a team and we take decisions in our board meetings. So, if there are any expectations from us, we'll definitely fulfill that. And I'll also put forward this brief interaction between us to that board meeting, that we were also not aware that there is a SAARC AVA also, and you are collaborating. So we look forward to an active and good interaction amongst the both associations. My best wishes to all the office bearers and team members. We look forward to interacting with you all. Thank you very much.
Thank you, sir. In fact, SAARC Regional Veterinary Association is a newborn association. Our secretariat is located at Kathmandu, Nepal. So we have members from all the 8 countries. And every year we award the eminent veterinarians of the SAARC country. This year, actually, we are honoring our physicians this year. So we are very happy to honor you as an eminent physician, come anesthesiologist of SAARC region. So we will share the certificate with you soon, sir. Thank you. And in fact,
I thank you for that honor. I thank you for that honorary honor, because I think I am being felicitated without any contribution. So, but as a respectful gesture, I accept this honor with all humbleness. Thank you for that honor.
Yeah, in fact, we just say who is anesthetist. So I asked one of my friend, can you define? So he is anesthetist working in Hyderabad. So he told in one line, anesthetist doctors are very cute. They can take your breath away and very skillful to bring it back. So thank you, sir, for this, presence, and we are really excited, to have a collaboration with you. We'll definitely look forward, sir. Thank you, sir.
Thank you very much. So nice.
Have a nice time. Yes, please. Now, without further delay, may I invite Dr. Anil Kumar J. Naik, the Secretary General of Indian Medical Association. I think he has some issue in joining. In fact, Indian Medical Association and Indian Veterinary Association are working collaboratively in a lot of projects like One Health, antimicrobial resistance, mixopathy. So there are a lot of things we share. I think he is unable to join. Okay. Then moving forward, may I invite Dr. Sushant Malaba Arachi, the treasurer of our SAARC Regional Veterinary Association from Sri Lanka, to give the workshop recommendation with a closing remark and way forward. Dr. Sushant. Dr. Sushant?
Yeah, thank you, Dr. Abhima.
Yeah.
For inviting me and also holding this very important session. Actually, as you said that SAARC Veterinary Association is not a old one, but we started in 2022 June, and now we are reaching to the second year of SAARC Veterinary Association. And I am glad that Dr. Bimal is the program director, and he is very active in coordinating all the works with national and international eminent veterinarians. And also today is a special day because we are just commemorating our World Veterinary Day. It was just yesterday because yesterday it was the last Saturday of the month of April, and I must sorry, I must recall our past late Dr. Who is the president of SAARC Veterinary Association. We selected him as the founder president, Chirantan Guardian, and we must respect him, and we wish him a very pleasant, peaceful stay in the heaven. And also today, I must thank Dr. Nasrul Islam. He's the vice president, SAARC Veterinary Regional Association, and also Dr. Sital Kaji, and he's the general secretary, and also all the members of the SAARC Veterinary Association Executive Committee, and also all the participants, especially the presenters, eminent veterinary surgeons, and also the human doctors who have been here for us to share your knowledge. And also, I really appreciate their very, very active participation and also the very nice presentation. And also, the purpose of SAARC Veterinary Association is to share the knowledge among our region, especially because we have a similar interest in all our SAARC regional countries, and also we have highest population in the region. I believe that it's a very important thing because we have the diversity, human and animal, and then veterinary surgeons need to play a vital role in that. And I am sure that as most of the eminent speakers mentioned, a veterinary profession is the most respected profession because our patient can't speak, and veterinary surgeon need to understand their language, and we need to treat them properly. And that is different between human medicine and animal medicine because patient can't speak. And today's topic is very interesting because anesthesiology, as Dr. Bimal mentioned, that one of our eminent speaker had mentioned that you can take people or the animal to heaven and also people to heaven and then immediately bring back without any harm. So that is a very important saying, and I really happy to mention that in Sri Lanka in ancient Sri Lanka, that is 340 to 368 AD, we had a 57th king of the Sri Lanka, that is Buddhadasa. You can go through the Google and see that history of that particular king, and he is artistic king, and also he is a surgeon and physiologist and a veterinarian and anesthesiologist. So that shows that the One Health was started in 340 to 368 AD in our history. So that is a very good thing that One Health policy is not a new thing to Sri Lanka and also to the world. It has been extending from long history. You can read the Mahavansa, that is one of the long and old history book in Sri Lanka. And also you can read about Dr. Buddhadasa, King Buddhadasa. So then you will realize the history of our anesthesiology and also veterinary surgeons and also the human and physical surgeons. He was one of the I may say that it is the only king who had that experience. So without taking much time, I must thank all the eminent speakers and all the eminent doctors who are going to be recognized and award the best recognition award from the SAARC Regional Veterinary Association. And I must congratulate all eminent doctors from all the countries of SAARC region. And I'm sure that they will enhance the knowledge of the people about the value of veterinary surgeon and also help animal to survive and recover from diseases. And to prevent diseases is most important thing. And I'm really happy that during the COVID period also, all the vaccine companies headed by veterinary surgeons, and they initiated the vaccine production, and it shows that veterinary surgeons are not only for animal, but preventing diseases and treating human also. So that is the key message that veterinary surgeons are the most valuable health worker according to the World Veterinary Association team. I believe that not only a worker, he is a professional, and because he need to take decisions and analyze things, and he need to decide everything. So he is not only a worker, but is a super professional in the world. And with that, I must congratulate again for the awardees, and also I must thank special thanks to Dr. Bimal who organized this event, and on behalf of Sri Lanka Veterinary Association, and also as the treasurer of the World Veterinary SAARC Regional Veterinary Association, I congratulate all the eminent doctors who are going to award the recognition, and also the again for the speakers and all the professionals and invitees and everyone. Wish you a very nice evening, and I hand over to the Dr. Bimal.
Thank you, sir. Before we conclude, the most awaiting part which is there is the award ceremony. I think I will share my screen right now. Yeah. Any questions till now? Then we can, take it forward. Any questions from audience?
I think it is enough time we have spent. So
yeah.
I
think I will just read the names instead of showing all these things. Maybe there are a lot of persons from our Sri Lanka there. So from Afghanistan we have Dr. Nasir Ahmad, then Dr. Farad Safa, who are actually been awarded as the eminent veterinarians of Afghanistan. Then from Bangladesh, we have 20 veterinarians. From Bhutan, we have 15 veterinarians. From India, also, we have 20 veterinarians. From Maldives, we have only 5 veterinarians, Dr. Anu Sahamanti, Dr. Muhammad Sajid, Dr. Akash, Dr. Hussain, and Dr. Muhammad Jamil. Then Nepal, we have 15 persons, vets. And I will read out the Sri Lanka because Sri Lanka has all the participants are mostly joining from Sri Lanka and other countries. So from Sri Lanka, it is Dr. Loku Galapitege Sampath, Dr. Santiago Jamini Lal, Dr. W. Madhuvanti, Dr. A. Mohammad Jifar, Dr. LGS Jayasinghe, Dr. A.P. Bodhave, Dr. GCS Kurugale, Dr. Pim Burage Ruvini M. Sanika, Dr. SSS De S. Jagoda, Dr. A.W. Kalupahan, Dr. Kirti De Diselva, Avivera Gunasekara, Dr. Bhagini Irandi Pathirana, Professor Narayan Vijayawardene, Dr. M.A. Nadir, Professor Dr. R.S. Kalupahan. So thank you for all and congratulate all the award winners. I will share the certificate soon with you because we have not yet it is under the process of design, and it will take a lot of time to read everyone's certificate right now. So hope you understand this thing. So now without any further delay, because you are already delayed by 10 minutes, I think 15 minutes. So I will now request Dr. S.M. Nazrul Islam sir. He is the Vice President of SAARC Regional Veterinary Association, and he was the past President of Bangladesh Veterinary Association, to say a few words about collaboration among SAARC countries for mutual help and professional support. And also I will request him to propose the vote of thanks. Please, sir.
Good evening. Can you hear me, Dr. Bimal?
Yes, you are visible and audible. Just a small black mark is there in the middle. Just see.
There is this screen, maybe.
Okay. Can you go ahead?
Yes, I am trying. Maybe this one is.
Yes.
Is it okay now?
One more is there.
Sir, one more is center.
Center?
Yeah.
Oh, anyway, I cannot remove this black mark anyway.
Sir. Okay, sir, go ahead.
Good evening. It is too late, I think. My name is Dr. S.M. Nazrul Islam. Till I am the president of Bangladesh Veterinary Association. And I like to congratulate and express my highest regards to all the participants, particularly all the executive members, including President and Secretary of a Veterinary Association of all member countries and eminent veterinarians who have joined already. And especially today, at the time of celebrating virtually the World Veterinary Day 2024, there is a good assembling with human health services leaders and the veterinary professionals leaders. I mean the human health anesthesiologists and their leaders and the human health professional associations leader and veterinary associations leaders are all together today in this celebration program. And thanks to Dr. Bimal for organizing this sort of nice program. And I like to congratulate and welcome each and every participants, the leaders and eminent veterinarians from veterinarians and human health expertise from different countries. It is I feel very pleasure having seen these things. The Indian veterinary professionals and the human health professionals, they are jointly working. Of course, nowadays all over the world, maybe in on health concept, we are working together. And this year's theme was veterinarians are essential health workers. I really realized these things from the core of my heart, and there is a lot of proofs because we are producing I mean the feed animals, both dairy, poultry, and others, and thereby we are providing the valuable part of the human nutrition, and at the same time we are assuring the food safety during the processing of this animal food, and ultimately we are taking care of prevention for zoonotic diseases. And many of the speakers in the world nowadays, they used to say among all the infectious diseases, more than 70% are being originated from animal origin. Though there is a debate, but still I like to repeat these things. Because of this, the veterinary professionals, they are working for environment, keeping clean, infection-free. They are producing safe, infection-free foods, and they are supplying best nutrition to the human population, and ultimately keeping the human health and producing the talented population throughout the world. So it is perfectly said, veterinary professionals, veterinarians are the essential health workers. Saying these few words, I like to start a simple presentation as I have been assigned to do that. I like to welcome you all to my very short presentation. I am very happy to be here in front of all of you, the highly qualified audiences today. And if I miss to address any leaders, any participants, please forgive me, pardon me. I am not a very good speaker. Particularly, I'm not a very good English speaker, but I am trying. We have every association, they have a particular aim to conserve, to look after the welfare of the association members. So SAARC Regional Veterinary Association is definitely is to take care of the welfare of the country's veterinary professionals and their progress, their promotion, their encouraging, and their every facilities sharing among the member countries. Among these things, I like to say again, this is very important and relevant activities of the regional association for which we are here in the SAARC Regional Veterinary Association. Ultimately, we are to welfare of the member countries' veterinary professions and professionals. There is also facilities, and we are to look for exchange of professional culture and practices in member countries, mutual help for the development of human resources, particularly for the veterinary professionals. Again, we have enough scope, and I have the idea. I myself has prepared this short presentation, which I am showing in front of you. The professional expertise, we can help each other and we can exchange among ourselves. We can share our education. Some of the countries, particularly India, at the moment they have almost 75,000 registered veterinarians in their country. They have a lot of veterinary research institute, veterinary universities, and they have a lot of professors and scientists, and they have developed to a certain level. So with the people, we can share their knowledge, their ideas, their expertise, and even education. We like to harmonize the veterinary education in these regional areas so that we have produced more than enough veterinarians, and some of our countries, they may lack in number of veterinary professionals, so that we can help each other by visiting the needed countries. And again, resources related with veterinary professionals, either animal feed animal, I mean the animal agriculture, feed animal production, their product, I mean the expansion of and extension of their products, and processing, and ultimately providing for the human population. And not only the feed animals, wild animals, zoo animals, pet animals, and a lot of even the animals used for a security check. Even today, this is very important, and veterinarians are playing their roles in such areas. So some of the countries are very highly skilled and well-trained professional expertise. We can exchange and we can share our research knowledge. Even we can share the technologies among our member countries. I have told already, we can share our all expertise relating veterinary professionals and ultimately on health concept. Even today, we are very much engaged, very much. Today, we have assembled together the human health leaders and the veterinary professional leaders. We can, in any way, we can cooperate, we can collaborate, we can extend our hands of cooperation for any technical assistance, any technical ideas, any technologies. That may be for any, say for example, I have cited some example. That may be for any new disease outbreak investigation, and new disease outbreak investigation. What is happening nowadays throughout the world sometimes, and formulation of those control program. And that can be for establishing any new mega livestock industries, like scientifically well designed and well structured, huge big dairy farms or poultry farms for animal production, ultimately needed for the human consumption, or maybe establishing some processing plant like milk processing plant, meat processing plant, or some other value-added diversified product producing and processing plant too. We can have the idea exchange program. We can have the sharing of expertise, and we can have the visiting facilities to some well-developed countries for sharing their experience and their establishment, and thereby we can try to produce in our country those who are still needed. Or that may be for establishing for any urgently needed disease investigation laboratory or quality control laboratory, like or any quarantine laboratories also. Very short presentation I have, so don't be discouraged or don't lose your patience. I have mentioned already collaboration for research, education, and training purposes also. We can have the program for training programs. Some of our growing veterinarian, young veterinarian, they may need to have some extraordinary, well-ventilated training from training experience or country visiting experience from some well-established and well-developed professionals, facilities, countries like India. We have that. We can have the sharing exchange program too. What I like to say, any new necessities of any member country or countries to establish a new research laboratory, which is well established in some of our member countries already, we can have the idea from those developed countries, and we can make facilities in our less developed countries, or which country still waiting to establish those sort of establishment of those sort of research institute or laboratories or training facilities. For education and training, again, I am telling, we can help each other country too, willingly or making some programs matching with each other. That should be so that we can cooperate each other for their development. Strengthening cross-border activities, sometimes we have that experience. We are very much surrounded by India and then Myanmar. So we have some experience. We should have the strengthening cross-border activities, sharing and exchanging ideas, and sharing the programs which we may have conjointly. We may need it for controlling some emerging and re-emerging transboundary animal disease, thereby helping the prevention of zoonosis from animal to human health, public health, ultimately, because the veterinarians are playing very important roles for taking care and prevention the exposure to the human health, thereby controlling the public health, thereby playing very important roles in the public health concept. Even in animal transportation, we may need such type of help, even when necessary. We need it. Sometimes it happens. We people, our Bangladeshi people used to import a lot of animals, both feed animals and pet animals, and some lovebirds too. Maybe some animals are, some of the rich people from our country, they're going to visit, they're going to even live for migration, they're going to Australia, they're going to Canada, America, and they're having some pet animals with them too. And that should be definitely disease-free, well vaccinated, and that should not transmit the disease from one country to another country. Can you listen to me? I mean, I am almost ending my presentation and speech. like animal quarantine, isolation, and identifications of disease or causal agents, and take necessary actions so that we can prevent the spread of the diseases from country to country, and we can stop the transboundary migration of the diseases. Education standard harmonizing is another concern. But I like to say some of our countries, we have enough capacity to produce more learned veterinarians, and that can move to some other countries who really needed some experts from this high concentrated veterinary professionals. Like from India, from Bangladesh, some other countries may hire the veterinary professionals. So education standards should be well adapting with the neighboring countries too, particularly Asian countries, Southeast Asian countries. So if and when necessary, take health, and we can make a collaboration too. Urgently needed pharmaceutical products. Am I connected properly, Dr. Bimal?
Hello?
Can you listen to me?
Yes, I can hear you. Are you talking to me?
Hi, yes, almost I'll be finishing. We in our Bangladesh, we have a lot of pharmaceuticals, veterinary pharmaceutical producing plant, but a lot of companies are producing, and they have to import ingredients from India, from China, from Germany, from America too. So we can have collaboration.
Dr. Nasrul sir, we have with us our WVA President, Dr. John Day Johnson joined.
All right.
Can you just wrap it up so that I will invite him?
Yes, I almost. I have. Should I stop or should I conclude?
Just invite Dr. John Day.
Should I stop or should I conclude?
Then I will.
Yes, Mike.
You can conclude here. I think let Dr. John. I will invite after your presentation. Yeah, please
and
go ahead,
then later on I will become again. Okay, thank you.
I guess I'll say a few words. I have a few minutes. I wanted to join you, even though I had a full schedule. I just got back from the United States, from the World Veterinary Congress in Cape Town, South Africa. We had an excellent meeting. First of all, yesterday here in the United States and globally was World Veterinary Day. And it was so important to be able to celebrate with colleagues and with the public at large to let the world know that veterinarians are essential health workers, and we are. You know, we do so much. Everybody thinks of us as companion animal doctors taking care of people's beloved pets, but we are also food animal production, food safety, epidemiology, research and education. The list goes on and on. Wildlife and exotics, aquaculture, public health, the human-animal bond, animal welfare, and One Health, which of course is the intersection between animal health, human health, and the environmental health, making sure that everyone knows that we are intertwined and we coexist for life on this planet. I want to just wish you guys all the best with this meeting. I'm short on time. However, one of the things I was asked to comment about was anesthetics and anesthesia in pets and animals. The reality is that in many parts of the world, we have on the WVA a working group on pharmaceutical stewardship led by Olatunji Nasir, who's a veterinarian in Nigeria. And the one thing that he reminds us of all the time is that in Nigeria and in so many countries around the world, there are a lot of veterinary medications, including anesthetics, that are unavailable. And it's a complicated problem. It has to deal with the corporations that produce medications. It has to deal with government and authoritative regulations that are somewhat prohibitive, which often forces us to go outside of what might be best practices to use human medications or any drugs that are available for us to do what we do. So again, veterinarians are essential health workers. We do what we have to do. I remember many, many years ago when I was in veterinary school learning that if you even had a bird with a broken wing, if you had to take a popsicle stick and put it together with some tape on the bird's wing, you could try and put a splint on. So, you know, veterinarians are very good at adapting and doing what is necessary to provide the care for our patients. And again, I'm glad you guys are having this meeting. Unfortunately, like I said, I got back and I was in church this morning and I've got other things now, but I wanted to give you a quick call to say hello, wish you all the best with this meeting, and thank you for having me.
Thank you, Dr. John, and it was indeed a pleasure to be here, with us in this meeting, and we look forward for more cooperation between World Veterinary Association and SAARC Regional Veterinary Association. Thank you, sir.
We appreciate that, and we appreciate the membership of every country that's a member of the WVA. And my goal and plans in the next 2 years that I'm president is to try and get more countries to join the WVA, because globally, if we speak with one unified voice, we will have that much more strength when it comes to helping governments and regulatory authorities understanding, and the public to understand the breadth and the depth of our noble profession and how important we are to everything that people do to survive and animals do to survive. So thank you again and wish you all the best. Glad I could be with you for a few minutes.
Thank you, sir.
So long.
And we actually, on behalf of SAARC Regional Veterinary Association, we feel privileged to honor you as the eminent vet of our world. Thank you, sir. Yeah, I do apologize, Professor Nazrul, sir. You can continue, sir.
Okay, thank you very much. Then I need not to share the screen again. I will not take time. Thank you very much, Honorable President of World Veterinary Association, for joining John de Jong with us. And I'm at the ending now. So we have a lot of scope for collaboration among ourselves. Saying this, with these few words, I like to conclude my presentation. At the same time, I like to thank each and everybody, including the World Veterinary Association's president and other member countries, president, secretary of the association, and all other executive committee members, and all the eminent veterinarians who joined here and will be awarded appreciation certificate. I like to salute each and everybody. I like to express my highest regards and heartfelt felicitation for all the participants and all the listeners who are listening this evening. On behalf of Bangladesh Veterinary Association, I like to congratulate all of you. I like to express my highest regards to you. And on behalf of the SAARC Regional Veterinary Association, I like to express highest thanks to all of you. Be in good health. The medical specialists who are here today, I like to salute them. I like to express my highest respect for them. And we are really happy to get you all together. And we have learned a lot of things from the very, very good presentation on anesthesiology. And I have some experience too, as I had been working in many important institutions, including Central Veterinary Hospital, including our National Zoo and Central Cattle Breeding and Dairy Farm. I have some practices also using these things. I became very much bona fide out of those presentation. Finally, I may leave something, I may miss something, but please don't mind. And we are very much pleased to have you with us. And I like to thank you also again. Be in good health and try to continue this collaboration. And those good speakers who are speaking well, particularly, I don't like to take enough time, but I can mention all the names. Anyway, but all the participants, please be in good collaboration with each other and the veterinary professionals. We like to see the far development in our professional side, and we will help ultimately the human health ultimately. with these few words, I'd like to conclude here. Thank you very much from my own side, from Bangladesh, and thanks from the SAARC Regional Veterinary Association. Particularly, many thanks to Dr. Bimal, our program director, who was nicely organizing this program and presenting very nicely. And thanks to everybody. Thank you very much. See you. Good evening.
Thank you, sir, for your nice presentation about the collaboration. We definitely look forward to take it forward. And under your leadership and guidance, definitely, SRVA will see the new lights. And I would like to specially thanks to Mohammad Ijaz, sir, the president of SAARC, Sri Lanka Veterinary Association, and also the counselor of our SRVA, and his team for facilitating, his supporting the Zoom platform and the YouTube link in time. So it was really worthy to participate in this workshop and learning a lot, especially for me and my Indian counterparts. Thank you all, and see you soon. And we will share the certificates very soon with you. Thank you all. With this permission from our Dr. Nazrul sir, we can close the meeting.
Yes. Thank you very much once again.
Thank you, sir.
You can leave now. Thanks to all participants again.
Yeah.